Hello, and welcome to our webinar, Start the Movement, a progressive canine osteoarthritis staging tool, sponsored by Elanco and Covetrus. I'm Amy Bucher, and I'm going to be your host today. Today is April 25th, 2019. If you're watching this webinar live, you get to earn 1 continuing education credit. If you're watching a recording, there are no CEs available. We have an interactive and fun webinar planned for you today. A couple of things to note. There are 3 videos in today's webinar, and if you want to hear the audio on these videos, you're going to need to be on your computer because for whatever reason, the system does not allow the sound to come through on a phone or an iPad. We're going to email links to those videos, so if you are on a phone or an iPad and you do want to hear them, you'll have that opportunity after the webinar. Also, you're going to want to grab a pencil and a piece of paper because our presenter has some activities for you today, and you're going to want those with you. Also, we have a Q&A session at the end, so go ahead and put your questions into the GoToWebinar control panel, that Q&A section right there, and we'll do that at the end. I'm very excited to introduce today's presenter, Dr. Elizabeth Capitano. Dr. Capitano earned her degree as a doctor in veterinary medicine from North Carolina State University in 1999 and was inducted into the Psi chapter of the Society of Phi Zeta, the Veterinary Honor Society, in 1998. Prior to veterinary school, she attended Davidson College and received her BA in psychology in 1993. After graduation from veterinary school, Dr. Capitano practiced small animal medicine in Charlotte, North Carolina for 7 years. In February of 2006, she changed her career path and moved into industry, joining Hill's Pet Nutrition as the consulting veterinarian for North and South Carolina. During her time with Hills, Dr. Capitano educated the veterinary community on the benefits of good nutrition through clinic seminars, local and regional VIV MA meetings, webinars, and daily visits with veterinarians in the region. She also worked closely with the specialists and key opinion leaders in the area to share new research and information in the field of nutrition. In 2006, 2007, and 2013, she was named one of 3 finalists for the Mara Award, which recognizes individuals within the company for their leadership, commitment, and innovation. In February of 2013, Dr. Capitano joined Verbach Animal Health as a regional veterinarian for 8 states in the Mid-Atlantic region. During her tenure with Verbach, she provided continuing education to veterinarians and healthcare teams in the fields of dentistry, parasitology, behavior, and preventative care. She also served as a technical advisor to the marketing team for dentistry and created the technical training programs for the launch of several products. In February of 2017, she moved to Elanco and joined the team as a regional consulting veterinarian. She received approval as a RACE-accredited speaker in April of 2017 for multiple disease states, including parasitology, immunology, and pain management. In addition, Dr. Capitano completed her fear-free certification in February of 2018. Through her work with Elanco, she continues to provide support and education to veterinarians, specialists, and key opinion leaders throughout the Southeast. Dr. Capitano is an active member of the AVMA, the NCVMA, AAHA, and the American Heartworm Society. Dr. Capitano resides in Charlotte, North Carolina. In her free time, she enjoys hanging out with her husband and her 2 sons, cheering on the Pineville Falcons travel hockey club, dancing in Zumba class, and playing with her bulldogs. Dr. Capitano, we are ready for your presentation.
Well, thank you, Amy. I'm so excited to be here today and really thrilled to get to share this new tool with you guys. This is something we've needed for a really long time. And I know as you begin to look at this, you're going to realize that this is going to be a big deal as we start implementing it in practice. Before we get too deep into this, I know a lot of you guys have actually mentioned where you're from and why you're here, and I just appreciate your time today. I understand it's hard to stop what you're doing in the middle of the day. We'll also tell you this may feel a little different than some webinars you've gone to before. We know when we're doing web design and we're doing virtual training classes that engaging with the audience is a little harder than when you guys are sitting at a dinner meeting with us. So we've done a little bit more interactive approach with this one. So you'll find yourself every 5 to 7 minutes or so, we're going to be doing some type of activity together. But hopefully it will be fun and it will keep you engaged. So let's go ahead and get started. Now, before we dive into COAST, I want to share a video with you that was created by a group called the Canine Arthritis Management Group out of the UK. This video is designed for pet owners, but I think it speaks profoundly to why we're all here today. So take a second, enjoy the video, and we'll talk a little bit about it at the end. So that one for sure is a bit of a tearjerker. I hope I didn't make anyone cry at work. It took me a long time to view that video and not have some tears, because I think it really does speak to our world. We are full of compassionate people who believe deeply that we're here to help animals and prevent pain. I love that video. And I'm asking you to do a little favor for me. It's a little bit personal, but if you could just write down on your pad and paper, just to yourself, 2 or 3 words on how that made you feel, because I think it's a really powerful piece. And I will tell you guys that video is available on YouTube. Some of my hospitals have started using it as an education tool for clients, so it's really a great tool to have in your toolkit. All right, so let's start looking at COAST. Now, before we get too deeply into understanding the tools, let's talk a little bit about the disease. This slide's very striking to me because we tend to see a lot of prevalence data on OA, but it tends to be related to dogs that are 8, 10, possibly 12 years old. And we saw in the video, 80% of dogs over the age of 8 in the UK actually have this disease. But this slide really speaks to me because this is not talking about dogs that are 8, 9, and 10 years old. This is talking about dogs that are over 1 year of age. I don't know about you guys, but when I see a dog over 1 year of age, or 2 or 3 or 4, I don't always start thinking about OA. We do know that this is the #1 cause of chronic pain in the canine population. So this is a pretty significant disease for our canine friends. Interestingly enough, canine OA is a little bit different than human osteoarthritis. In humans, the disease truly is a disease of wear and tear. So the longer that you're on the planet, the more things you do on your hips and on your knees, and the more activities you have really develop this wear and tear syndrome, which eventually leads to osteoarthritis. In dogs, it's a little bit different. This actually is a disease of conformational abnormalities. So I laugh and I say these dogs were born this way. They're Lady Gaga dogs, right? So think about the breeds that have dysplasia. Think about your cruciate patients, the little dogs that ride around in Louis Vuitton bags and have luxating patellas. These are the guys that we really know have an intensely higher risk factor of developing OA. We look at these patients and we're not thinking about if they're going to develop disease. We're truly thinking about when that's going to happen. So it is a little bit different, but I think our diagnostics and our diagnosis process has really leaned more towards our geriatric patients. So one thing COAST will help us do is do a little bit of a paradigm shift to look at these guys a little bit earlier on in the onset of disease. So clearly we've got a little gap. If we're diagnosing most everybody after 8 years of age, but we have a whole host of animals that are potentially going to develop OA because of congenital abnormalities, then we're sort of missing some animals in the middle. And I think that that quiet onset of disease that we often see is very subtle. So COAST will help us and help our pet owners find a better way to see things sooner so we can intervene earlier. We've learned a lot about pain in the last few years, and we know a lot about pain as far as chronic pain in dogs. I think a lot of you guys have seen this before, but I'm going to review some of the maladaptive pain syndromes that can happen with chronic pain responsive in OA. So first of all, if you have a dog that has joint disease and they're having sustained nociceptive responses from that local site of dysplasia or whatever it may be, that's continually signaling to the neurons in the dorsal horn. They're continually getting those nociceptive response. It truly is maladaptive. What happens in the dorsal horn of the spinal cord is those neurons become perpetually excited. They're releasing glutamate and they're signaling through the spinal cord to the brain that there's constant pain signaling going on. Now, this becomes worse and worse to the point of that peripheral stimuli doesn't even have to be nociceptive anymore. It could simply be touch, but the dorsal horn and the brain are perceiving this as a pain response. Obviously, this is a really difficult thing to deal with, and maladaptive pain is one of the characters of chronic osteoarthritis that is really hard to manage. The idea with COAST is that we will get our patients in sooner and we will control pain earlier so that we don't have as many coming in with this hyperalgesic state. And you guys know this, if you have an animal with significant disability secondary to pain, and you have a lot of issues and the owners are in frequently, and we're having a hard time finding the right medications to address the problems, a lot of these owners begin to think it's time for that animal to move along and that we can't keep them comfortable enough to allow them to stay. So many of our patients that come for euthanasia wind up being here because they've got mobility problems and they have unmanaged pain. This is obviously the last thing we want, especially with a disease like this where we have so many treatment options to control and manage. So take a second and think about the euthanasias you've done in the past few months. And think about how many of those patients or what percent of them had mobility problems, or their mobility problems may have been their primary reason for coming in for that. I'm sure some of them were suffering in silence. We know that's a very common part of this disease. But let's think for a minute now. What might it be like if we didn't have to euthanize patients because of primary mobility issues? That would be a really great thing. We know we're going to have animals that have, old age diseases, if you will, but it would be wonderful if we can manage osteoarthritis from such an early time that it doesn't contribute to those decisions. So let's look a little bit about this tool. Now, the COAST tool is obviously an acronym. You guys have probably figured that out. It's the Canine Osteoarthritis Staging Tool. And it was developed by a group of 9 international specialists. And these are specialists in orthopedic surgery, anesthesia, and of course, pain management. This group of folks began to realize that we really needed a standardized approach to stage this disease. We have tons of staging tool in veterinary medicine. We use a lot of different things like this. But this particular disease was difficult because someone's mild arthritis at one clinic may not look like someone else's at another clinic. There's a couple of unique features that the COAST tool has that a lot of our staging tools don't. And one of the first things that I think is really unique about it is it was really designed for general practice. This was made for us, and I love that. I think that's really wonderful. We all know that oftentimes things that come down from the ivory tower may not be quite as applicable to what we do in our day-to-day lives, but I think this one definitely is. The other cool thing about COAST is it includes your risk assessment of your at-risk patients. Now, these are the dogs we talked about that may not have clinical disease yet, but they've got that genetic gun loaded, or they have some of those risk factors that we think about when this disease begins to develop. That's a really important thing because that allows for early conversations, and it allows us to start looking a lot sooner than 8 to 10 to 12 years of age. The last, and I think the coolest part about COAST is the fact that this is not just a veterinary thing. This is really involving the entire healthcare team. I love this. We have so many people in our hospitals who know so much about dogs, and when we start looking at dogs walk and watching them stand and doing all these orthopedic analysis, it's really helpful to have more than one pair of eyes on the patient. So you'll see as we go through this is a very holistic approach. It's designed to involve everybody on the team as well as the owner. And you'll recognize that's got a little bit of a different feel from it than maybe staging periodontal disease might. So this is our group that developed COAST, and I'm going to point out a gentleman in the middle. This is Dr. Lissa. He's actually out of NC State, which is my neck of the woods, and he's been very instrumental in the development of this program and this tool. The other very cool thing that the COAST group has done is they've recognized that COAST is a work in progress in some ways. So as we're implementing this in hospitals and as we're spending time together utilizing the tool and figuring out how to make it work in our world, they really would love to hear from us. So jot down this Gmail address, and if you have any type of input for them, I'm sure they would love to hear it, because we're really trying to make this one of these tools that becomes part of our daily lives. Now, this is the journal article that was published in 2018, and this just sort of goes through the process of how COAST was developed, some of the rationale behind it, and then, of course, some of the validity testing that they sent the staging tool through. This is attached to your handouts, so if you're interested in giving it a read, please download it from your handouts. I'm also going to give you a website in a little bit where you can download all the tools we're using today, so you will have access to all these pieces. All right, so let's play a little bit, guys. Now, I want to go ahead and launch the poll, and I believe John's going to do that for me. This poll really focuses on what are the risk factors for this disease. Now, we know that there are things that predispose. We know obviously genetics is part of it, right? But what are the things that we see and make us think, oh, this dog is probably going to have a problem with OA in the future? So go ahead, if you're not sure how to vote, if you're on a mobile device, you just go ahead and use your touch screen. If you're on a PC, you can use your mouse and click on the correct answer. So this is like the SAT too, guys. There's always an answer that you can rule out immediately, but you can probably figure out which one this is on here. By the way, type A folks, no stress here. We're learning together, no stress. If you're wrong, it's really okay. We're going to learn this as a team, and you will know these risk factors by the time we're done today. I promise you that. All right, John, how we doing out there? We about ready to share our poll? Awesome. Good job. You guys are brilliant. I knew that. So obviously the risk factors that we have a great deal of concern with include age, breed, so genetics, of course, previous injury, previous surgery, weight, which is a whole other webinar, right? And activity level. What's the dog's job? So those are the things when we start doing our staging that we're going to consider when our patients come in. All right. Thank you very much. John, can you hand it back to me? Thank you, my friend. All right. So remember, genetics, job, hit by car, hit by surgeon, overweight, age. Those are the things you're going to think about in those preclinical patients. Now, once a dog develops clinical disease with the COAST tool, things change a little bit. You don't get points for risk factors. By the time you're a clinical patient, you just move up the scale. So I'll explain a little bit of that as we get deeper into the tool. But keep those risk factors in the back of your mind because we will see them again. All right, so here's what we do when we're doing COAST scoring. Very simple process. Grade the dog, grade the joint, stage the disease, then do it again next year. This is a very easy thing to do. And I'm going to challenge you as we move through this, think about this because a lot of this stuff you're already doing and you're doing regularly. COAST is just organizing it in a little bit of a different approach. So the first step is to grade the dog. Now, I want to talk a little bit about this because we know in animals with chronic pain that the owner's assessment can be one of the most valuable resources that we have. In fact, if you're trying to get FDA approval as a drug company for a drug for chronic pain, they require that we have these validated owner questionnaires. They really don't care that much about force plate analysis anymore. It's just not in anymore. They really want to see these validated questionnaires. Part of that is because the owners live with the dogs every day and have a much better assessment of how the animal is truly feeling versus us having them in the clinic for a short period and just getting one moment in time of that dog's existence. So the owner questionnaire goes through a series of questions where we try to uncover exactly what's happening on a day-to-day basis. The other thing the owner is going to give us is some idea of what the overall level of discomfort is. We often forget to ask about that. In humans, it's very normal to do the pain scale from 0 to 10, but we forget sometimes in our canine patients to ask the pet parents how the dog's feeling. So I want to show you guys a little bit more about these questionnaires because they seem a little scary when you first see them. Now, these are 4 different types of clinical metrology instruments. That's the fancy name for these. And I want you to focus on the load form. This is the Liverpool Osteoarthritis in Dogs Index. This is the form that is involved in the COAST analysis. So this is going to be one that you will see. And I will tell you guys, we've been able to make this available to you at our work at Elanco with the COAST group so that you can utilize this as you're implementing COAST in your hospitals. But I don't want you to be afraid of it. So we're going to spend a little time with it so you'll have a comfort level with it. I'm going to give an honorable mention to the CBPI because that was actually the CMI that we used in our approval studies for Galliprant. So we've got some mad love for that one too. All right, so here's what the load form looks like. And you're going, oh no, that's a lot of questions, isn't it? Whoa. Don't stress. Don't panic. There are 23 questions on this form. They are multiple choice. And they are really easy. Now, I know that you have some owners that are going to make this hard, but in reality, this is a very simple form. I think most owners could fill it out anywhere from 5 to 7 minutes. So let's play a little bit. Everybody find your hand tool. You should be able to find it if you're on your iPad. You actually should see it up in the right-hand corner. You guys should have it on your control pad on your PCs. Now I'm going to read you some of the questions on the load form. And I want you to raise your hand if you have ever asked a client something like this when you have had them in either for a wellness exam or even possibly an orthopedic exam. So here's our first question. You ready? How long has your pet been suffering with his or her mobility problems? Yeah. I think we're going to see that most everybody has done this. So for sure, this is a very, very common question to see out there. All right, let's try another one. Raise your hand if you've ever asked this question. How active is your dog? I know that's pretty simple, isn't it? And the options range from extremely active to not at all active. Now, I'll tell you guys, as the owners answer these questions, they actually are applied a numerical value. And when you download the form, you'll find that the form itself calculates that for you. So don't stress. It does it all for you, which is really nice for those of us that are not huge fans of doing math. All right, so here's our last one. What is the effect of your dog's lameness on his or her ability to exercise? Extremely affecting it or not affecting it at all, and then there's range in there. So see, the load form is not scary. It's really easy to do. And this is one of these pieces that if you'd like to send it out prior to the appointment, that would probably be very helpful. But it's also something that's achievable if the owners decide, while you're doing a gait analysis, maybe they're going to fill out the load forms. So there's ways to manage this so that it's not a big time consumption in the exam itself. Now, don't forget, we're also going to talk to the owners and ask about the dog's degree of discomfort because that's an important part of our assessment. All right, now here's where we come in. And it's not just our veterinarians. This is the entire healthcare team. So everybody's going to be involved in this process. We're going to watch dogs sit. We're going to watch dogs stand. We're going to watch dogs walk. So our next activity is a pretty easy one. And this is one you can do with your paper, so you don't have to raise your hand or do anything wacky with the screen. What I'm going to do is I'm going to show you a series of 3 slides, and there's going to be 6 photographs of dogs on those slides. You have to decide when we get on the slide whether that dog is in an abnormal posture or if that dog is normal. It's just like vet school, right? You got to learn what's normal first. And as we go through, I'll give you a second to decide, but you can go ahead and we'll talk about exactly what we see on that slide and some of the background of these patients. So all you have to do is write an N down for normal or an A for abnormal. There's only one normal dog, so just be ready for that. All right, so this first little dog, this boxer, you can see she's sitting kind of in a side saddle position. So she's number 1. Is she normal or is she abnormal? I'll give you a hint. She's at NC State. That might give you a hint. If you're doing this in a group, you can always talk to your friends. It's okay to phone into a friend for sure. So this little girl is in an abnormal posture. Dogs like this are usually trying to protect their stifles. When a dog typically sits and they're comfortable, they'll flex those stifles fully and they'll tuck them under their body. But she's very reluctant to do that. You can tell she's kind of pushed everything out to the side so she doesn't have to go in that full flexion. So she is not a normal patient. She's also at state, so you guys probably figured that out. All right, let's look at dogs 2 and 3. So the dog on the left is 2 and the dog on the right is 3. Are they normal or abnormal? Does this look like it's supposed to? There's something crazy going on. Yeah, okay, so this little one over here, you can actually tell her weight is shifted entirely to that left side. She's really uncomfortable on this right hind limb. And you can actually appreciate, you kind of see against the vet student scrubs, that there's probably a little bit of muscle atrophy right there. She's awfully woolly, so it's hard to tell, but she is certainly not comfortable. There's definitely some type of orthopedic anomaly going on here. How about this kiddo? Again, dogs at NC State that Duncan's taking pictures of, it's probably a good sign. So this kiddo, obviously, he is toe touching on that left forelimb, and he's got a very awkward stance on his back limbs. Now, I don't know if that's from shifting his weight back or if that's actually a sign of congenital disease. He certainly is a breed that could have a problem with that. So he's definitely got some discomfort right now. All right. So here's our next slide. We have 3 dogs on this slide. So this is going to be dog 4 up top, dog 5 down here on the left side, and dog 6 on the right side. So decide if this group is normal or abnormal. Now you've only got one normal dog and you haven't found it yet, so it's probably on this slide, right? Okay, so this kiddo up top, that dog is absolutely normal. He's also at NC State, I can tell. Look at his posture. He has just beautiful posture. No flex in his spine, no bowing, no abnormal shifting of weight or offloading going on. He's really lovely. He could be in a beauty pageant. The dog down on the far left, however, has got some issues. So one thing that's very pronounced in this dog is that flex in the spine is really, really profound in this patient. Really pushing all that weight forward. We know this dog actually has bilateral hip dysplasia, and you can tell it's very uncomfortable for her to bear weight on those hind limbs. Actually, I think he's a he. Oh, and bless this one's heart. This poor dog, that is just not good. So you look at him and you can tell his weight is all shifted forward. He is not wanting to put any weight on those hind limbs. And in fact, he has pretty severe disease. Duncan shared that with us. You can even maybe appreciate there's some disuse atrophy right there. But obviously, this dog does not have a normal stance. He is abnormal. Good job. See, you guys have this. This is so easy, isn't it? All right, so we've watched some dogs stand and sit and things like that. Let's watch them walk. Now, I love this quote from Duncan because I think we forget about this. But if you watch dogs move, you'll find that a lot of them are working really hard to avoid using painful joints. They don't want to use them because it hurts. So they have all these strange compensatory mechanisms and gaits that they will utilize so that they don't have to have this painful experience. That makes a lot of sense when you think that a dog is a pack animal, and if you show pain or you're decompensated in the pack, that is never good for your long-term well-being. So the next set of slides, we're going to watch some videos. Now, this very first video, we're going to watch this Rottweiler walk. She's adorable, first of all, but I want you to watch how she moves. And I want you to think for a minute, do you know a dog that moves like this? There are a lot of dogs out there that do this. And I will tell you, I think a lot of owners think this is really cute. And it is cute until you realize that it's pathologic. So let's go ahead and watch her, and then we'll talk a little bit about it. The voice you hear, by the way, is Duncan. So that's Dr. Lascelles, for those who do not know him.
Let's take a look at a great example of this in this young Rottweiler. Now, the first thing you see is that rounded back that we talked about earlier, indicative of weight being shifted forward. But more pronounced than that is this wiggle of the hips from one side to the other. And what this dog is doing is minimizing movement of the hip joint, but still effecting forward motion by swinging the hips to one side and then to the other. Now, this is hard work, and dogs are only going to expend energy for something if they are avoiding a significant problem. So this whole abnormal gait is indicative of significant hip pain.
She's obviously in some pain. But the problem with this too is a lot of times these animals have developed these abnormalities over time. And when we see that, a lot of times the owners, it's so subtle, they don't notice that it's happening. So think about a dog, that walks like that Rottie with that cute little Marilyn Monroe swivel. And that one's one we definitely want to bring in and check out. All right, this next patient, this dog is a forelimb lameness. And this dog is clinical. So when we're coast scoring, we're going to do something a little bit different with this dog. And the risk factors sort of they're not by the wayside, but they are less important as you're looking at clinical disease. Here's the thing with this dog already has 2 risk factors that are so evident. I feel like if we'd gotten this dog sooner, we could have prevented a lot of this. So go ahead and watch this video. Again, this is Dr. Lascelles talking on it, and see if you've seen dogs do this. By the way, my equine folks will enjoy this video because this is very much like doing an equine lameness exam.
Okay, so now let's take a look at an example of a forelimb lameness. And remember, what we're doing here is trying to determine when the head is going down, and that'll tell us the sound limb, and then conversely we'll be able to detect the unsound or the lame limb. So as the dog's moving along, we're looking at the head and we're looking at down, down. Let's look at that again. Down, 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 down. And as we're saying down, it's the limb that's hitting the ground when we say down that is the sound limb. Conversely, it's the opposite limb that is the uncomfortable one. In this case, the left forelimb is more uncomfortable than the right, and that is the one that we need to focus on.
So that particular dog had obviously a forelimb lameness. Again, risk factors, pretty easy, right? Retriever breed, that's one, and then a little bit of a weight problem for sure. So if we had gotten that dog in sooner, we might have been able to intervene and not have that significant pain signaling on that forelimb analysis. So watching dogs sit and watching dogs walk and watching dogs move can give us so much information when we're understanding the disease. It also really helps us understand where we need to spend time when we're talking to the owners. If you can help them understand where we're having problems, they can look for things like the cute little Rottie swivel that may be cute but may not be a good thing. So you've done the heavy lifting now. We've graded the dog. Yeah, it's true. Now you're going to do what you do every day. We're going to go ahead and grade the joint. And this is a simple process. So grading the joint simply involves, we're going to do a good orthopedic exam, we're going to assess range of motion, and then we're going to do radiographs. Now I know sometimes in a wellness exam, it's hard to find the time to fit radiographs in. I've had some clinics tell me that they are using COAST, but deciding maybe if they can't get radiographs to do a preliminary score of COAST. So that's an option, but it sure opens the door to have a conversation with the owners that this is something you really need. Either you found something that's physically abnormal or you have one of those risk factors. So those radiographs are going to be very valuable at seeing what's happening in the future with this pet. Muscle atrophy is your friend. It is not the dog's friend, but it can certainly help you identify exactly where the disuse is and the discomfort is. And obviously you can see this is a pretty profound situation with this dog, but it does give you some physical markers of where to search for disease. And remember the acronym CREPIT. Those are the things we're going to look for when we're evaluating the joints. So you're going to look for crepitus, range of motion, effusion, pain, instability, and thickening. Good job. We love our acronyms, don't we? That's it. You're done. Now we're going to stage the disease, and then we're going to do it again next year. So the next part of this, we're going to work together and we're going to stage these cases. I'm going to give you two examples. I'm going to give you one that's preclinical and I'm going to give you another one that's clinical. So I want y'all to use your chat box and I want you to write the stage down. Now, if you're embarrassed to use your chat box, then you can write it on your paper. That's cool. But we're going to look at the co-stages together and we're going to figure out where these pages fit in. Quick review. Preclinical dogs with no risk factors, that dog is going to be staged to 0. That's a wonderful thing. You want that 0 if you can get it. It's much unlike most everything in the world. We don't usually want a 0, but we do for this. Now, if the dog is preclinical, no clinical signs, but has a risk factor, 1 or more, then they're going to have a co-stage of 1. Now, this is not a cumulative risk factor thing. If they have 4 risk factors, they don't get more points for that. You're going to just put the 1 on there because you know that you've got the risk factors available. And then finally, clinical disease is simply broken down into mild, moderate, and severe. And these particular categories are assessed off the information we gathered earlier. So you guys have got that. All right. So let me tell you a little bit about this dog. So this is a golden retriever, and she came in for her 3-year visit. She is adorable, and she is happy, and she will lick you to death, which is wonderful. She weighed in about 7 pounds over what she was last year, and she's edging into that overweight category. So we went ahead and we did our scoring. We graded our dog, and we graded our joints, and here's what we found. We didn't find anything. That's good news, right? There's not a lot to see here. When we did the joint analysis and we did our orthopedic exam, same thing, not a whole lot to talk about. So if you're going to look at this preclinical example, you're going to grade her to the highest overall severity of disease, which for this dog is going to be low to none, right? But remember what I told you about her. So I want to give y'all a second to tap into the chat box. What is the stage of OA of this dog? What do we think? It's either going to be 0 or 1, right? Because she's clinically comfortable. We're not having problems. All right. Brilliant class. Brilliant class. So this dog, because of her breed and because of her weight, she's going to have a co-stage of 1. Now, if she didn't have those risk factors, she would be a 0. But I think you guys can see how valuable that's going to be to start discussions. I don't know if y'all have as many doodles out in the world as we do in Charlotte, but I think this is going to really help move those conversations along and help us have that early assessment tool we need to talk to these pet owners about what may be next. All right, good job. You guys got the preclinical. That's probably the hardest one. All right, so remember, we're going to look at clinical patient. 2, 3, or 4 are your staging numbers for that. So this dog actually did have clinical disease, as we mentioned. And you can see there was pretty much moderate on everything except for discomfort. So you may have a stoic dog, and I know we have those. I know I have one of those. So the discomfort is mild, but everything else is in the moderate range. Orthopedic exam. Oh, everything's pretty much mild on that one. So this particular dog, even though there's more check boxes in mild, you score to the highest level. That's important to remember. Now, a lot of people are like, why? I want to score to the numbers of the most checks. Well, because one of the things we do know is the disease is progressive. So one of the things that COAST is trying to encompass is the fact that this is a continual process. And I know you guys are probably going to jump in and make like 2.5s and 3.5s, and that's fine. You do you. But I think this is one of those things where if we look at those higher check marks, it just makes us ever more vigilant of what's coming in the future. All right, so take a second. You can either type in whatever you think the answer is, or you can type in a numerical score. All right, so this dog is going to have moderate on the staging, and that wraps up to 3. Good. See, I told you this was easy. You guys have this, not hard at all. So really, that's it. That's all you're going to be doing. And if you think about it, we went through every single step together today, and it's a really simple process. This just organizes it in a way that makes sense and allows us all to have the same language. Everything we used to generate this staging tool and to generate these scores today is available for you at galliprantfordogs.com/vet. So feel free to go there and check it out. We also have all of the resources for this attached to the handouts and the webinars. So lots of places where you can access the information. All right, so let's look a little bit now about what do we do once we have a COAST score. This is exciting. We've got a staging tool and we love it, but now we have a dog with a 1 and we don't have a plan. So one of the things that I think is in COAST's future is treatment recommendations that apply to the score that you have or the stage that the dog is in. And I think that's coming. It's just not here yet. So one of the things we have to consider is if we found the disease, what are our next steps? Now remember, we have a big gap here because we're not really diagnosing most of these patients until 8 years or up. So there's a lot of animals that potentially have these subtle changes that could benefit from some intervention. So obviously this disease has a lot of different tools in the toolkit, which is wonderful. We have NSAIDs, chondroprotectants, obviously diet and exercise are very important, rehab, stem cell therapy, laser therapy. There's a ton of options out there. And we know the multimodal approach to this disease is really the right way to go because you're able to support the joint in various different ways by using different types of medications. But I want you to remember this because this is important. This disease is characterized by pain and inflammation. That is the cornerstone of osteoarthritis. And we know that that's sort of the beginning of the dominoes, if you will. Joint pain, joint inflammation, discomfort, all of that starts the dominoes to fall. So then we have decreased exercise and weight gain, stress on the joints and the ligaments and the chondrocytes, and then we actually have changes in the cartilage and the subchondral bone, and here we go again. It's a cyclical process. So the best tools we have on the planet, we know this, to control pain and inflammation are our NSAID class. We're going to look a little bit of our NSAIDs now. We're going to talk a little bit about using them for this disease because I think this is worth a review, and I think it helps us to understand how we can intervene when we have these early diagnoses. So, John, do you mind launching our second poll for me? So, guys, I'm going to ask you a question. Now, there's no right or wrong answer to this one. This is an opinion poll. Those are fun, right? Because everyone has one of those. So here's what I want to know. I want to know why you think that our pet owners are not compliant with the treatment plans that we have for their dogs OA. Why are they not doing what we think they should be doing? And there's a lot of different reasons that it could be. You can choose from those. Oh, by the way, this is a pick two choice. Just like Panera, you get to pick two. So why do you think it is that they may not be doing what we need them to be doing? I was going to add another one that said they found a better option on the internet, but I didn't do that. All right, going to give y'all another second or two. Now, I will tell you guys, we've actually given this survey to veterinarians, so it's going to be very interesting to see how you guys match up with the folks who've already taken the survey. All right, let's launch this poll and see what everybody says. Wow. Okay, so 78% of you guys thought that cost might be an issue. Yeah, I think that's pretty common, and I think we do see that a lot of times. We've got about half of us who think that the owners don't think the dog needs them. That's possible. We've got about 30% forget to give. Safety is an interesting one. We're going to come back to that in just a minute. And then we've got a little bit that believe maybe the owners can't give the meds. That's probably true too. So I think all of those have some legitimacy when we're talking about that. And I know when we looked at it on the survey, we got some answers that were very similar. So John, can you hand me back control, my friend? Thank you. So here's what the surveyed vets said. Over 2/3 of them, which is very close to what you guys did, which was about 3/4 of you, decided that cost was probably one of the main reasons that people aren't doing what we need them to do. And then about half of them thought, well, maybe people just forget. Maybe they just forget to give them. So that's not just a problem with osteoarthritis treatment, is it? It's a problem with a lot of things. Now, here's what's fascinating, because we asked the very same question to pet owners. Here's what they told us. They told us the number one reason that they maybe weren't following through is that their doctor told them that they only needed to give it as needed. Now, don't get upset. I know some of y'all are fussing out there. The reality is, though, we do that. We tell them to use their pain meds, especially as needed, and sometimes they don't know when that is, right? And we've also been taught and trained that we should give these medications at the lowest dose possible with the longest time interval possible between them. So I'm not surprised that we saw that. Now, interestingly enough, the pet owners had safety concerns too, which I'm not overly surprised about. This class is not just a class in veterinary medicine. A lot of pet owners take NSAIDs, and I dare say in the human side of the world, there's been some black eyes in that world. So what they're trying to tell us, I think, is they need us to give them a really clear, concise idea of what give as needed means and what that looks like. And that's usually true with most things. They really need some clear guidance, because if we don't tell them what to do and when to do it, they're going to look it up and let Dr. Google tell them, which we all know how well that turns out. So this was a fascinating quote from Duncan. he believes, and I think he's probably right, that we have an embedded fear of utilizing these drugs in dogs that are younger, especially when we're looking at years of use. And I think that embedded fear is probably a real thing. Anything that suppresses the arachidonic acid cascade can potentially create problems. So I think this fear is founded in a lot of ways, but I do believe that we have this concern when we're thinking about putting a 3-year-old dog on one of our more traditional NSAIDs. But Duncan also believes that Galliprant may be a way to help us all be significantly more comfortable with that idea. Galliprant is not a COX inhibitor. It does not touch the arachidonic acid cascade. I'm going to let that simmer for a minute. Yeah, Galliprant does not touch the arachidonic acid cascade. It doesn't. Instead, this product actually works on a cellular level. It works at the EP4 receptor, which happens to be one of the receptors for prostaglandin E2. PGE2 has 4 different types of receptors. And it happens to be the one that moderates about 80 to 90% of the pain and inflammation with OA. So it really, really has a different MOA than most of the drugs on the shelf. It's obviously designed for dogs with OA and dogs over 8 pounds and 9 months of age, so you guys know how to utilize it. But it really does have a very different mechanism, and I think that is going to make it a very unique tool to have in the toolkit. I know a lot of you guys already use Galliprant, and you have them in 14-year-old dogs. So clearly, targeted pain relief from the earliest diagnosis stages of disease, really targeting on the cellular level versus that global suppression of the cascade. First in class. I like talking about this because it's very, very infrequently in veterinary medicine that we get the drugs first. And this is the only piprant that is out on the market in either human or veterinary medicine. So the fact that this receptor antagonist got into the veterinary world first, I think is pretty cool and pretty exciting. Again, targeting EP4, that's the main specific target of this. And obviously, when you're having that cellular targeting of EP4, that's going to reduce a significant amount of impact on the GI, liver, and kidney homeostasis. So all of the housekeeping and constitutive enzymes that we need and the prostaglandins and thromboxanes that we need to go do work are still going to be available. In fact, and this is pretty unique for this drug, when the FDA went through the approval process, typically on NSAIDs, they require that there are regular blood work intervals for these drugs. So they'll require that you bring the dog back, for instance, on a 6-month schedule to have a biochemical panel done, right? And with Galliprant, as they were assessing the studies associated with the drug, they actually provided no recommendation on those label requirements. So you've got some flexibility there. Now, I know if you've got it in a 14-year-old dog, you're going to pull that kiddo back in every 6 months anyway. So that's not surprising, and that's exactly what I would do too. But on a 2-year-old, this might be a very nice thing to have in your toolkit if you don't necessarily need to see them on a 6-month interval, but instead want to keep them on a yearly exam schedule. Cool. All right, so here's a pictorial representation of Galliprant, how it works. You can see here, not messing with phospholipase A, not inhibiting COX-1 or COX-2. So those days of arguing whether inhibiting COX-1 or COX-2 more or less, all that are pretty much over. This is the key here, working on that EP4 receptor, specifically targeting that pain and inflammation that's associated with OA. Pretty cool stuff. All right, so here's some safety information on Galliprant. It is in the NSAID class, so we do recommend not using it with other NSAIDs and not using it with corticosteroids. Obviously, we talked about the fact it's for 9 months, 8 pounds, and it's not been studied in breeding pregnant lactating dogs or dogs with cardiac disease. So if you want more information, obviously, we've attached the PI to the webinar, and you can also go to Galliprant for dogs. Oh, by the way, you have homework. I don't assign homework, and I will not know if you do it, but check out the safety study on the product insert for this. I just think it's such a great read, and it really gives you great insight into this drug and how unique it is and how different it is from its predecessors. So take a minute if you haven't and check that out. All right, with that, I think we kind of realized that we've got a great new staging tool. We've got some great new medications in our toolkit. We've got an opportunity to really start COAST and make it part of our world, make it a standard of care. We're going to have a lot happier patients, a lot more comfortable patients, a lot happier clients. And I'll honestly believe that's going to make us a lot happier. So happy veterinarians is a good thing these days. I know we're almost to the hour, so I'm going to go ahead and open the floor. Does anybody have any questions out there?
Well, right before we get to those questions, really quickly, I want to make sure everyone realizes that there are 4 handouts. Dr. Capitano referenced those, but if you look in the handouts pane of your GoToWebinar control panel, you can click on any or all of those 4 PDFs and open them up, and you can download them to your computer, and I recommend that you do that.
Yes, thank you.
So here's a question. Where can they find the COAST tools, and how do they get started with those?
Oh, well, we kind of answered that. The COAST tools are actually they're attached to the webinar, so they're right there. But the Galliprant4dogs.com/vet, all the tools are on there. So the interactive load forms, the printable load forms, the COAST forms, all of them are on that site. So there's a couple of different places you can access that.
Great. All right. We'll take just a few more questions because we are at the top of the hour. Barry wants to know, how effective is Galliprant for the ages stage 4 OA?
So Galliprant went through significantly challenging efficacy studies. The CBPI, which was the clinical metrology instrument that was utilized in the efficacy trials with this, was really a challenging questionnaire. The dogs that were on Galliprant were actually required to improve the severity of the disease and the interference of the disease to 1 and 2 whole mean points. So the reason that becomes important is when you start looking at it, that bar was very high. And over the 4-week period of patients that were on Galliprant, over 48% of them showed that highly significant level of improvement. I think that's really one of the things that sets it apart a little bit, because most of the drugs we see, when we think, oh, safety, we think, well, maybe not efficacy. I will tell you guys, though, if you have a dog that has maladaptive pain, they're going to need more than a simple NSAID. So remember that too. You're going to have to look into other modalities if you have a dog that's got that hyperalgesic syndrome going on.
All right, one more question. What is your preferred joint supplement?
Well, there's a I know a lot of Nutramax people, so I use Dasequin. I love Dasequin. Movaflex, which is a Verbac product, I've actually utilized too, and my older bulldog who's no longer with us. I think it's very individualized per patient. So part of it is finding a product that's gone through the NASC Supplement Council and, trying to get as much of the active ingredients actually in there as possible. I think we've all seen the things out there on some of the nutraceuticals where there's question marks as to whether they actually contain any active ingredients at all. So I try to discourage clients from running to Walmart and just picking up the glucosamine on the shelf there, and instead really doing some research and picking out some products that we know have some evidence base behind them, which both of those do.
Excellent. Thank you so much, Dr. Capitano, for your presentation and your expertise today. Thank you to Elanco and Covetrus for sponsoring today's webinar, and thank you to all of our webinar participants. There will be a survey when you exit the webinar. Please complete that survey and allow up to 2 weeks for your CE certificate to be emailed to you. Also, to thank you for attending our webinar today, Covetrus and Elanco will be sending each of you a promotion code to use on your next purchase of Galliprant. Watch your email tomorrow for this special offer. Thank you, everyone. This ends our webinar presentation.
Thanks, Amy.